SMFM always does an amazing job with their organization of the meeting. And so pretty true to form, my full interests lie within the fetal therapy environment. But also my passion and subset in addition to that is the psychosocial aspects of the program. So the infrastructure for screening and psychosocial programs that are embedded within the maternal fetal community, and how we can best serve the fetal centers with that approach as well. So the fetal intervention and innovation piece of the meeting, as well as the psychosocial piece of the meeting, are my absolute favorites. Yeah. Twins and multiples are always on the mind. And in a sense, the fetal therapy community really is probably, on top of that data as it's ever changing, especially in the setting of monochorionic placentation. And so I think that, in the era of where we are right now in the world, having knowledge of multiples and just the kind of ever existing fetal center piece of your go-to fetal center person that you can just give a call and say, something looks a little funny, and what do you think about this? Or what does the data say about this? It's always nice to be in a, colloquial room with everybody and having everybody discuss all of these pieces of multiples, twins, triplets, and so on, so that we can kind of be on the forefront, so that we can answer colleague and friends' questions and concerns. And also, when they don't necessarily need to come to us versus when they do, and an intervention may be necessary, how to start and bridge that conversation. Also, how to start and bridge the psychosocial support conversation, because those are not easy times for a family. I think that that's what we're all invested in. It's all a uniform goal of patient support and care. I think the second thing is new innovative therapies. So we have spinal muscular atrophy and cystic fibrosis, not necessarily new, but really up and coming, more common discussions now of prenatal treatment. And I think that there's a lot more in the setting of genetics and gene therapy where that's coming from. And so we're all very excited about that, in addition to, some innovative new instruments and different discussions that we can also have. I think screening for spinal muscular atrophy is something that should be discussed. And, our prenatal genetics colleagues are really invested in best screening platforms and involving them early in the conversation with the families. Also very, very important. I think this is something, in our era that more families are learning about early on in their pregnancy, and they want the information, and we want them to have it so that they can make the decision to screen or not to screen, or to have further testing if that's, something that they're committed to.